Okay, this is Chapter 10 of the ATI Mental Health Brain Stimulation Therapies. Brain stimulation therapies offer a non-pharmacological treatment for clients who have certain mental health disorders. Brain stimulation therapies include electroconvulsive therapy, which is ECT, repetitive transcranial magnetic stimulation, which is RTMS, and vagus nerve stimulation, VNS, and deep brain stimulation, which is DBS. Electroconvulsive therapy. ECT uses electrical currents to induce brief seizure activity while the client is anesthetized. The exact mechanism of ECT is still unknown. One theory suggests that the seizure activity produced by ECT can enhance the effects of neurotransmitters. This is serotonin, dopamine, and norepinephrine in the brain. Indications, potential diagnoses, major depressive disorder. Clients whose manifestations are not responsive to pharmacological treatment, client for whom the risk for other treatments outweigh the risks for ECT, and clients who are suicidal or homicidal and for whom there is a need for rapid therapeutic response. Clients who are experiencing psychotic manifestations. Schizophrenia spectrum disorders. Clients who have schizophrenia with catatonic manifestations and clients who have schizoaffective disorder. Acute mania episodes. Clients who have bipolar disorder with rapid cycling, 4 or more episodes of acute mania within 1 year. Clients who are unresponsive to treatment with lithium and antipsychotic medications. Contraindications. There are no absolute contraindications. However, the nurse should assess for medical conditions that place clients at higher risks for adverse effects. These conditions include the following: cardiovascular disorders, recent myocardial infarction, hypertension, heart failure, cardiac arrhythmias. ECT increases the stress on the heart due to seizure activity and occurs during the treatment. Cerebrovascular disorders, history of stroke, brain tumor, subdural hematoma. ECT increases intracranial pressure and blood flow through the brain during treatment. Mental health conditions for which ECT has not been found useful include the following: substance use disorders, personality disorders, and dysphoric disorder. Considerations. Procedural care. The typical course for ECT treatment is 2 to 3 times a week for a total of 6 to 12 treatments for depression. The provider obtains informed consent. If ECT is involuntary, the provider can obtain consent from next of kin or a court order. Pre-ECT workup can include a chest x-ray, blood work, and ECG. Benzodiazepines should be discontinued as they will interfere with the seizure process. Medication management. 30 minutes prior to the beginning of the procedure, an IM injection of atropine sulfate or glycopyrrolate is administered to decrease secretions that could cause aspiration and to counteract any vagal stimulation effects, bradycardia. At the time of the procedure, an anesthesia provider administers a short-acting anesthetic, etomidate or propofol via IV bolus. A muscle relaxant, succinylcholine, is then administered to paralyze the patient's muscles during the seizure activity, which decreases the risk for injury. Succinylcholine paralyzes the respiratory muscles to the client, requires assistance with breathing and oxygenation. Severe hypertension should be controlled because a short period of hypertension occurs immediately after the ECT procedure. Any cardiac conditions like dysrhythmia or hypertension should be monitored and treated before the procedure. The nurse monitors vital signs and mental status before and after the ECT procedure. The nurse assesses the client's and family's understanding and knowledge of the procedure and provides teaching as necessary. Many clients and family have misconceptions about ECT due to the media portrayals of the procedure. Due to the use of anesthesia, the muscle relaxants, the tonic-clonic seizure activity associated with the procedure in the past is no longer an effect of the treatment. An IV line is inserted and maintained full until full recovery. Electrodes are applied to the scalp for electroencephalogram, which is EEG monitoring. The client receives 100% oxygen during and after the ECT until the return of the spontaneous respirations. Ongoing cardiac monitoring is provided, including blood pressure, electrocardiogram, and oxygen saturation. Clients are expected to become alert in about 15 minutes following the ECT. Complications: memory loss and confusion. Short-term memory loss, confusion, and disorientation occurs immediately following the procedure and can persist for several hours. Clients have retrograde amnesia, which is the loss of memory of events leading up to the procedure and have no memory of the procedure. Memory loss can persist for several weeks. Whether ECT causes permanent memory loss is controversial, but most clients fully recover from any memory deficits. Nursing actions: provide frequent orientation, provide a safe environment to prevent injury, assist the client with personal hygiene as needed. Reactions to anesthesia: nursing actions: provide continuous monitoring during the procedure and in the immediate recovery phase. Cardiovascular changes: nursing actions: monitor vital signs and cardiac rhythm regularly per protocol. Relapse of depression: client education. ECT is not a permanent cure. Weekly or monthly maintenance ECT can decrease the incidence of relapse. Repetitive transcranial magnetic stimulation. RTMS is a non-invasive therapy that uses magnetic pulsations, MRI strength, to stimulate the cerebral cortex of the brain. Indications: RTMS is approved by the United States Food and Drug Administration, or FDA, for the treatment of major depressive disorder for clients who are not responsive to pharmacological treatment. RTMS is similar to ECT but does not induce seizure activity. Considerations: educate the client about RTMS. RTMS is commonly prescribed daily for a period of 4 to 6 weeks. RTMS can be performed as an outpatient procedure. The RTMS procedure lasts 30 to 40 minutes. A non-invasive electromagnet is placed on the client's scalp, allowing the magnetic pulsations to pass through the client is alert during the procedure. Clients might feel a tapping or knocking sensation in the head, scalp, skin contraction, and tightening of the jaw muscles during the procedure. RTMS coupled with psychotherapy has been shown to be very effective in treatment of depression. Complications: common adverse effects include mild discomfort or a tingling sensation at the site of the electromagnet and headaches. Clients with a history of seizure disorders should use low-frequency RTMS. Monitor for lightheadedness after the procedure. Seizures are a rare but potential complication. RTMS is not associated with systemic adverse effects or neurologic deficits. RTMS is contraindicated for clients who have cochlear implants, brain stimulators, or medication pumps because the metal in the devices can interfere with the treatment. Vagus nerve stimulation. VNS provides electrical stimulation through the vagus nerve to the brain through a device that is surgically implanted under the skin on the client's chest, similar to a pacemaker device. VNS is believed to result in an increased level of neurotransmitters and enhances the actions of antidepressant medications. Indications: depression that is resistant to pharmacological treatment and/or ECT. The treatment is approved by the FDA. Current research studies are determining the effectiveness of VNS in patients who have anxiety disorders, obesity, and pain. Considerations: educate the client about VNS. VNS is commonly performed as an outpatient surgical procedure. The VNS device delivers around-the-clock program pulsations, usually every 5 minutes for a duration of 30 seconds. The therapeutic antidepressant effects usually take several weeks to achieve. The client can turn off the VNS device at any time by placing a special external magnet over the site of the implant. Assist the provider in obtaining informed consent. Complications: voice changes due to the proximity of the implanted lead on the vagus nerve to the larynx and pharynx. Other potential adverse effects include hoarseness, throat or neck pain, and coughing. These commonly improve with time. Dyspnea, especially with physical exertion, is possible. Therefore, the client might want to turn off the VNS during exercise or when periods of prolonged speaking are required. Deep brain stimulation. DBS is a treatment that surgically implants electrodes into the brain to stimulate underactive regions. These regions, which are underperforming in clients with depression, then function better. VNS is believed to result in an increased level of neurotransmitters and enhances the actions of antidepressant medications. This device is more invasive than the VNS and is implanted surgically, so it is reversed for clients who have tried many other. It is reserved for clients who have tried many other treatments that have failed. The nurse should use standard post-operative care for these clients. Indications. The treatment is approved by the FDA for Parkinson's disease and treatment-resistant obsessive-compulsive disorder. Considerations. Educate the client about DBS. DBS is commonly performed as an outpatient surgical procedure. The DBS device delivers around-the-clock program pulsations, usually every 5 minutes for a duration of 30 seconds. Therapeutic antidepressant effects usually take several weeks to achieve. The client can turn off the DBS device at any time by placing a special external magnet over the site of the implant. Assist the provider in obtaining informed consent. Complications. The pulse generators that are installed pose a risk for infection. It is possible for the client to experience hypomania without a history of bipolar disorder. Other potential adverse effects include headaches, seizures, stroke, and confusion. A nurse is providing teaching for a client who is scheduled to receive ECT for the treatment of major depressive disorder. Which of the following client statements indicates understanding of the teaching? I will receive a muscle relaxant to protect me from injury during ECT. A nurse is assessing a client immediately following an ECT procedure. Which of the following findings should the nurse expect? Memory loss and confusion. A nurse is leading a peer group discussion about the indications for ECT. Which of the following indications should the nurse include in the discussion? Bipolar disorder with rapid cycling. A charge nurse is discussing rTMS with a newly licensed nurse. Which of the following statements by the newly licensed nurse indicates an understanding of the teaching? I will schedule the client for rTMS treatments 3 to 5 times a week for the first several weeks. A nurse is planning care for a client following surgical implantation of a VNS device. The nurse should plan to monitor for which of the following adverse effects? Voice changes, cough, and neck pain.